All right, so healthy kidney function. The kidneys in general are useful for filtering out the blood, and so it's really used to extract any waste and excess materials um, from the body. And so we find that the kidneys serve as a filtration system to remove metabolic waste products. It also serves in helping to release or retain H2O levels in the body, so helping maintain a balance homeostatically, um, considering the implications of excess water in the tissue systems. Also, the kidneys help with regulating electrolyte levels as well. And in the end, of course, they end up producing urine for excretion of these waste products. Typically, the urine is supposed to be aseptic, and so you won't find bacteria um, or blood or excess proteins. These are things you shouldn't find in the urine. So presence of these things, of course, can be signs of illness. So as far as looking at markers for illness, we do see, as from the previous slide, we look at the presence of bacteria, blood, and proteins, certain proteins as signs of illness. These are some other markers that are used clinically. We have the BUN, the serum creatinine, the creatinine clearance, and the GFR, or the glomerular filtration rate. These biomarkers are used to identify any changes in renal function pre and post the administration of any therapeutic interventions. And so the BUN is typically measuring levels of nitrogen that come from the presence of urea, which is a waste product of a particular metabolic pathway. And so fluctuations in these levels, along with creatinine, can signify that there's something going on with the kidneys. The creatinine clearance and the GFR are essentially products of calculations. We use these calculations clinically to identify, again, those changes pre and post interventions, and also to signal when to give a medication and when to stop a medication. There are certain thresholds where we hold medication administration, and the creatinine clearance along with the GFR, most likely or more frequently the creatinine clearance, are things that we use to signify when to stop giving a medication as well, and we'll talk about that more in a few slides. When we're thinking about renal function and blood flow and filtrate production, I want you to be able to visualize what that looks like in each nephron unit, right? So the nephron unit contains these various components: the glomerulus, the Bowman's capsule, the proximal and distal convoluted tubules, your loops of Henle, and your collecting duct that leads to excretion, right? But when we're thinking about where our renal medications work, understanding this anatomy is very important, and understanding the flow or the physiology is important as well. So I want you to think, as an exercise, how would you trace the blood flow through a nephron unit, and how would you also trace the flow of the filtrate that is produced in the nephron unit as well? Okay, so I want you to also just kind of focus on the afferent arteriole and the efferent arteriole. Afferent is the direction that the blood takes when it's entering each particular nephron unit. So the nephron unit in this case is the entire, vasculature and tubular structure in the image in yellow together. But thinking about the blood flow, we have the entry through the afferent with an A arteriole, and we do have some exiting through the efferent arteriole with the E as well.